Thank you for letting me know. We are at 9 o'clock here in Florida, so we can get started if everybody is ready. So, assessing children with ASD in a variety of healthcare settings. My name is Gilbert. I'm the school nurse here at the Learning Center at the Our Center of Excellence. And I have some experience that I have gathered this year in how to assess students. If I say students, it can also mean patients, so you can change that word. All right. So I have a couple of pictures for you today, just to illustrate to you, and I hope that helps. We have wonderful students, wonderful staff, and we are a great team. So if you are working with anyone with autism, you are going to need that. I wanted to just go through a few things. We'll start with a scenario. We had one of pretty much my first patients were a non-verbal 4-year-old, and he came into the clinic with bleeding mouth, blood all over. He wasn't making any eye contact. He didn't want to be touched by me. We didn't really know him. He was a new student, and he was just wanting to lay down on his belly on the examination table. We also don't put the crinkly paper on the tables. He had his arms stretched out to the ground, and it just looked like he was not really listening to anything that I was saying. We had a couple of visuals, but if the patient doesn't know how to use it, it makes it hard. So we had the what hurts chart out for him, and while he was laying down, you can now start doing any physical assessment, like the quiet to sound to loud sounds assessment, so you can start listening to the heart sounds, the lung sounds. You can see if there's a rash on him, or you can just do a very assessment just where you need to do the assessment, focused assessment. So what we were talking to the student, explaining each step. That's obviously something you're always going to do. You're going to explain as you go. And we were reaching a point where I had done everything that I could have done assessment-wise. Now I need to look inside the student's mouth. So how am I going to do that? I was hoping that the student had somehow had any experience with going to a clinic, but he didn't. Even when we had done our health screening day, his mom said good luck. So I saw it was going to be a challenge. Always, it's very helpful is story-based interventions or social stories. Video modeling can also make all the difference for some of your patients. So this is the what hurts chart, nicely laminated. It can tell you, here's my finger, that finger is my finger. I need to tell the healthcare professional that that is hurting and be able to translate that this is my finger. But if it's not understood, it makes it harder. But it really helps with some students. Anything like that is very useful. So the what hurts chart came out, and the student also was new. He didn't have the PEC system. You know, the PEC stands for Picture Exchange Communication System. So if you want a Skittle, you're going to give me a picture of the Skittle, I give you the Skittle, and there's some exchange. We had also know the most successful our students are is if we break up every step in little steps, manageable steps, and we posted where they are going to do these tasks. For instance, brushing teeth would be right next to the sink in the bathroom, and they can follow. So I had only one option. I had to go lay down right next to him, and it with my arms stretched out, and then he made eye contact, and he held eye contact, and he smiled, and now I could start touching around his mouth very slowly and to his tolerance, and I could, with my gloved hand, now put my finger inside of his mouth to see what is causing the bleeding. And he had a chewy, it possibly nicked him, and we could see that it was just an easy fix. We washed out his mouth, washed his hands, and sent the student back to class. We can tell his mom the reason for the blood all over his clothes. So in 2 days, I went back to the class, and I made eye contact with him, and he came over to me, and he gave me a big old hug. So I feel that I never want to force any student, and if you want to build a relationship with your patients, you need a little bit more time with them, and that way we don't traumatize the patients so that they can come back next time. So that was very sweet. But if we look at our students, there's not just that one little thing. We have to think of other things, other dental considerations. So things that we commonly see in ASD students or patients is bruxism. About 20 to 25% grind their teeth. The medication can have side effects. It can make the mouth very dry. Non-nutritive chewing. There can be tongue thrusting. Self-injury, so picking and biting, and that everything can just carry on over a period of time and create ulcerations, erosions, and regurgitation, which at that point they really need to be seen by a doctor. Cavities, and in our student population there are so many students with cavities, also because they receive as rewards for behavior. So we see poor oral hygiene is really hard for some students and their parents to do toothbrushing, which we are adding to the school schedule, on our daily schedule for our students. So some students also have very limited dietary preferences. Some just have pureed fruit, no fruit or vegetables, and then this can stick to the teeth, and if we don't brush on a regular basis, then cavities can form. So we have to think of the causes and then help with your patient or the student this way. So also, if the next visit, if that student will allow us, we can look around his mouth with a lighted mirror or a pen light in a dark room. That's also very good. The dimmer lights, the students sometimes don't like the lights, so it's good because now you can really have a good look around. There's a strip. We also did a finger stick on a 182-pound boy, and he usually requires a few people to hold him down for any procedure. He hates the doctor, going to the doctor's office. So we took our time. He had his mother's permission. We first demonstrated it on his teacher. She talked the whole time and I talked the whole time just to explain to him what's happening, and we moved back every time we needed him to give us permission. So we would stand back onto the wall and just let him know we're giving him some time to process. Didn't say that, but then whenever he would say yes, we can do the next step, we'd carry on. And it was just great to see how the change in the student. He didn't fight. He was very calm the whole time. It was just a great experience for if you had to repeat it, it would be wonderful instead of having to hold the student down. So trainings you have received as a healthcare worker, it really helps and guides you to do your job well. For instance, if you're on a med-surg floor, you know that there are going to be certain steps. You have a hysterectomy, you have a catheter in, you communicate to the patient that at 4 a.m. you're probably going to have some gas pains. You have to follow the doctor's order. Excuse me, you have to accomplish a couple of steps. And the whole time you will communicate with your patient. And the patient is able to give you feedback and talk to you too. So I'm really interested in how would it look like if we had to do that for our students with autism. How can I translate this and make it a smooth ride so they're not traumatized afterwards? We know we need to communicate, whatever means they need to communicate, that is what has to be available to them at all times. I know you respect your patients, I know you remain patient, and you will give them the time that they need. You tell them one step at a time so it's manageable, and you can praise them the whole time throughout. That is really helpful. And you can have reinforcers. Then you might need to be really creative to find ways to get a task performed. So with Autism Spectrum Disorder, it's a group of complex neurodevelopment disorders, and we can see that that 1 in 68 children in 2014 were diagnosed with it, 1 in 42 boys, and 1 in 189 girls. So you might see it coming through your doors. Our sensory system, we have, as you know, the 5 basic senses: tasting, touching, hearing, seeing, and smelling. And Dr. Amy Wagenfield also posted the question, what will it look like if it's a hyper or hypersensitive sensory system? So we'll see if it's hypo, the patient will seek and they need more input. If it's hyper, they will seek or need less input from the environment. In a patient with autism, you might observe them just excessively mouthing toys or objects, so sorry, excuse me. You can see that they really have to get that input. So you can offer chewies, bubblegum, anything to help the students, obviously without posing a threat for them choking. The smell, you might see some students might be gagging or holding their nose, so we would avoid wearing perfumes or highly scented lotions, air fresheners, or strongly scented cleaning products. And with touch, that's a big consideration to have for students with ASD or patients. Some have excessive touching, some have withdrawal from touch, and what you would do, you would try not to crowd the patient into a tight group or a small room or a room with many people, if you can at all. You will keep fidget toys or preferred objects ready that they have access to, and you will, while you are doing your assessment, you will talk to them and let them know you are going to touch them very calmly. So I'm going to touch you on your foot. You might need to illustrate that on a family member if they do not know what to expect, or if you had a chance to basically prepare them with a story-based intervention, which I will get to what that is, or a social story, and you have to tell them how long you are going to touch them. You can count loudly with them, so you can count to 10 counts, and especially with blood pressures, that's very helpful. You can have some patient work for tickles or firm pressure. They can tell you on their devices, I need pressure, I need touch, massage. If a patient usually needs a hospital gown, for instance, you can decide this material might really be irritating to them, something new, and do I really need this gown, or can I forego it if it might offer a challenge? So hearing, we see some students rubbing their ears, crying, whining, covering the ears, and you can have noise cancelling headphones available. You can have some soft music, or just have very quiet room. You see the student, he will walk around with his ears in his finger, and another student will have the noise cancelling headphones. So whatever works for the patient. Seeing, you might see squinting, excessive blinking, rubbing eyes, might try to cover their eyes. So if you keep the lights dimmed, especially if a student or patient is in crisis, like they have to go to the ER, just see if you can dim the lights. And you'll avoid any visual clutter and stimulation. Our students are very visual learners. What makes sense to them is if you have exactly what is expected of them, step by step, and that will give you greater success. And our patients, our students can take things very literally. So if you have jokes or any metaphors or figures of speech that they haven't memorized yet, it can be confusing. So instead of saying break a leg, rather say good luck. Tell your patient exactly what you need, and you make the instructions very clear. And you use visuals wherever possible. If the patient has been prepared with a story-based intervention, their parent might use the story-based intervention during the visit, and that's great. Helpful words during an assessment. I don't know if you can see this. I really like it because at the bottom there's a pain assessment tool. There's yes, no, so you can ask a lot of questions with yes or no answers. You can ask them, do you have any pain? You can have it available. They have to touch it. There's also please wait. There's what can I expect from an ambulance ride? Ride. There's a Wong-Baker Faces Pain Rating Scale, which is helpful sometimes. Even that is helpful. And physical assessments can be performed anywhere. It doesn't have to be done in the room at this time. You can go for a walk in the hallway. If the student does not want to be in that examination room, you don't need to take the temperature in that room. You can walk and go back and forth in the hallways while you're measuring his temperature. Or have a look inside his mouth. Maybe you have better light in the hallway near a window, and you can really look inside a mouth and do a much better physical assessment and get cooperation. So I always believe that you have to be positive. Here we have a blood pressure story, my favorite story of a student that is on blood pressure medication. His mom requested that we take his blood pressure, if there's anything we can do, and we made a story-based intervention. We did blood pressures in the classroom, on his peers, and on the staff members, and so he has been around it. And then one day while he was on the playground, I thought maybe this will be distracting enough for us to do blood pressures right now. So I went and I sat next to him very innocently, and I started talking to him. Here you can see we had a staff member snapping pictures, and I think they're just a little bit too loud and a little bit too excited. So then you have to adjust your volume with the cues that you're getting. There he's starting to become a little bit upset, and he is vocalizing that he is. It sounds that he might be he just wants to be left alone, and I've mentioned blood pressures at this point, and that can also mean all done. He's all done. Thank you, go away. We have also see some students like to mock run away, so we know not to chase them, otherwise it is really going to turn into a situation where they are going to run away, and so with that we just sit and we don't react. I don't restrain him, I let him just be comfortable around me, and he sits back down. So we see that whenever we have reinforcers, we have a little bit more enthusiasm and cooperation, which is great. We mentioned the reinforcer. In this case, it's a special snack for him that his mommy packs for him. I love that face. There, he's pressing the button on that cuff. Isn't that amazing? And we are really surprised. While we are doing, see that face? Well done. And then you say, I like how you sat so still the whole time. So you're very specific in your phrase. When you're taking your blood pressure, you want to tell them it's going to give you a squeeze. I'm going to count to 10 with you. You have to keep really still. You can squeeze the other arm, for instance. This worked well because he tried to cover his ear, so it was still the whole time. And if you will say just a few more counts, then we'll be all done. There's the events, the order of it. And as you can see, we did blood pressures even outside on everybody. This is a story that one of the teachers made for story-based intervention. So it has one picture, one idea per page with the words on top of it. What we want to do is tell the student, prepare him, and not just say, oh, but you were supposed to do this. How are they supposed to know what to do if you don't tell them? So we want to make sure we prepare our students and talk to them the whole time so they know exactly what to expect. And communication, is more than just words. You have to have understanding. There can be gestures, expressions, facial expressions, and then we combine all of that. First and then boards are wonderful for just getting through daily activities, but you can use it when you have to do an assessment. So first we're going to do magnetic numbers, and then we can do a preferred activity like ball bounce. The visual aids that we use is first then choice boards, schedule, so they know exactly what is going to happen. Specific activity boards, self-help boards, and tokens. The student works for a computer, drawing, iPad, Oreos, lollipops, and gummies, and you can see around the staff member's neck there's a timer, and there's the cards, the visuals that can help the student. You can have stand, sit, wait, etc. The student is working for candy. He has to stay in his area, hands on table, and use his words. And every time the person sees he's doing a great job and he's putting in effort, he gets a token and he's working for something. So that is something that you can have as well. An overload, this might lead to aggression, and if you have something like this, it's too loud or I need a break, the patient can take a break and you can come back. You can say 2 minutes and then you can come back. If you want to be successful, I think you really have to maintain a professional, trusting relationship with your patients. You have to refrain from rough physical redirection, using physical intervention with a student not in a crisis, reactive responses, so do not react to challenging behavior, and loud or assertive directions we try to stay away from, and sarcastic or coercive comments. We will instead use verbal and gestural prompting, so a lot of pointing to let them know where you want them to go, and reinforcers is also amazing to help our students. And clear and direct verbal instructions is really important. We have positive for behavior with really specific praise. If you want to do an assessment on, for instance, the head, and the student is giving you a bit of run for your money, you will try and distract them, for instance, with a book or something, a little treasure that he really loves. Keep his hands busy and his mind off the procedure. And as we said before, we'll start at the feet. We have to work our way up to the top, or it can be really focused. We do training for students that do have a crisis. It's never body slamming, but it's just helping the student. If you ever need that training in a hospital, that can also help the student. We see that students can ambulate by hooking into you or you hooking into them, but probably the best for a student in a new environment is holding their hand and walking with them. That is fine. Some students really are great at reading, and they will follow almost all directions and handle transitions better when they're presented with reading or visuals of some kind. You let the student carry their words. This is the text system, and wherever they go, they have to have it with them. Or an iPad, you can see the student has I want, her options. You want popcorn. While you are walking, you can assess the student too. So, for instance, a patient presents with a possible allergic reaction. You have to kind of be quick about it. So you want a speedy assessment. You want to also choose what you want to accomplish and put the most effort and time into that, and let the parent know. For instance, I want to do blood pressures, lung sounds, pulse ox, and assessing the oral cavity, and then I want to really look at the skin closely. You'll get the input from a patient's parent, and you have to respect the patient and give them space and a little bit of time to process and to know what is expected. So your first encounter, for instance, you in the ER or a doctor's office, you will scan the patient and you'll form an initial impression as they are walking, for instance, for any skin abnormalities. Once again, you don't have to do it in the exact room. If you have an appointment with a student or a patient with ASD, you will best know it's an unfamiliar environment, and if a student has to sit with for an extended period of time, it just places unnecessary stress on them. So the best would be you have an appointment to stick to that time, and then collecting data, your chances have now vastly increased. The room should, it's best if you see a student is challenged to have a dimly lit room, quiet, secluded, maybe off to the side, no clutter, spacious is great, and you close the door and start the assessment as soon as possible. So if you are in the, for instance, ER, don't have a whole staff coming in at the same time, one at a time. So before the examination, you are going to seek out the parent or the family member, and you're going to get information. You'll ask the parent, away from the patient, what the patient does and does not like, and may or may not tolerate, and what should be done first. So you discuss the priority, and the patient might allow you to do more, or you might just be able to do a focused assessment. Ask about the communication, the methods the patient uses, and reinforces. The tools that we use are built for speed. So our blood pressure cuff, we use the wrist blood pressure monitor, and we say it's like wearing a bracelet, and give you a hug and count. Even if it takes a little bit longer, you just stretch out the counting. So you're doing great. You hold their hand quietly and keep it still, and we have had a lot of success that way. With pulse oximetry, you tell the patient that it's going to sit over the finger for 10 seconds, and then you're going to count for them to 10. With temperature, you can demonstrate this on a family member, how you would take a temperature. It just goes on the head, and it's going to make beep, so it's going to make a noise. The patient might let you do this in a location other, like for instance the triage area or the examination room. You might just go for a walk and have the temperature taken. Your approach, if a patient does not want to enter a specific area, for instance, they want to walk around a little bit more, you go once around the nurse's station and then you try to re-enter the room. If it's still a no, then choose another location. It could be, an assessment can be done on the go, in a quiet hallway somewhere, if the patient wants to keep moving, and bring your equipment. So physical assessment head to toe can be now done toe to head, depending on what your patient allows you to do. You're going to always ask for permission. Move back, let the patient process the request. And when you give the permission, you move forward slowly and talk through the steps. You can demonstrate on a family member before you start, and you talk as you go. Even if the patient does not make eye contact, that does not mean that they are not listening to you. You always address the patient and talk to them, not just about them. And you don't have to speak loudly. You can use your pleasant, calm voice. And do not repeat the same thing over and over again if the instructions are not understood. You'll try and find another way to say it, and the minimal staff. And we've seen not every person is the same, just like we see that in autism. It varies greatly, and you just have to find the similarities and see if you can work with that patient as best as you can without traumatizing them. So I really think in every encounter with an ASD patient, you just have to take a moment and really appreciate it. Every student is so incredibly unique, and they have their own abilities, and it's wonderful. It's just wonderful to see our students, and I don't have the words. Yeah, it was one of our moments in CPR training, and everybody is having a great time. So we going on to vision screening. We did a health screening day. We have had to do it at school, started from scratch. So how do you do any kind of screening, health screening, at your school or in your office, in the doctor's office? We saw that we really need pictures or visuals, and then the steps broken into smaller pieces, and the students have to get to know the material and know how to perform the task. Preparing the students, we had to send out an opt-out form for screening completed. Not everybody wants to have everything done, so you have to always communicate with the parents if they do not want something done. And there's always an option to opt out or do it at a later stage. And the story-based intervention has to be drawn up and distributed to students that are going to do the screening for their vision, hearing and growth and scoliosis. The student can be shown how to do many things that would normally be difficult for them by video modeling, and you're going to explain step by step. So video modeling is if somebody does step or task, and you just play to the student at least 5 times. You start by writing a few lines, for instance, as a Word document. Just get the ideas of what you're trying to tell them, and very plainly, very clear, very concise. And then you're going to add the pictures. You're going to set the font to a little bit bigger, and it's always on top of the words, and add pictures that will be meaningful to the student. A health screening is something I do at school with the nurse, and then it's great if you can add the pictures of the nurses that's going to help them, and or just the color of the scrubs. Like we had dental students coming, and everybody wore purple, so we had pictures of dental students in purple. Now, I will see some helper nurses that day, give them names even if you like. And the health screening is something I do at school with the nurse. It is a fun thing to do. I will get a prize from the treasure box afterwards. When we do a task, we'll have one task per page. The nurse will check to see how tall I am. So we will have the picture of somebody measuring somebody's height right in front of where this is going to happen. And you can even practice before the time how you do it. You stand with your back towards facing the room and not the wall, and you will put your legs back onto the wall, and that way you will stand tall. And we will count again. 1, 2, 3. The nurse will check to see how much I weigh. I will step onto the scale carefully and count 1, 2, 3, 4, 5 with our hands on our bellies, and the nurse will tell me to step off the scale carefully. So you can have the task picture laminated and placed by the scale. You can also have like Shrek footprints on the scale, and you can tell them exactly where to stand on the Shrek footprints or whatever character you would like to use. You can place a sticker of a popular character and just ask them to stand right there. With scoliosis, the nurse will look at my back. I will take off my shirt, and then I will touch my toes. You can have them touch a surface so that they know exactly how far to lean forward to. For instance, the examination bed. And if you can have little handprints of where you want the hands to be, and you will count again 1, 2, 3, 4, 5. That is also something you can consider. The nurse might even touch my back with a tool. It's called a scoliometer, and I will put my shirt back on. You will avoid having other students at this stage, just you and the patient. And if you need somebody else to help you, you will have very limited amount of people in the room. A nurse will check my eyes and take a picture of them. I will have to sit still and look at the camera. And we've had great staff helping with this. And it's with, for instance, the spot vision that they use. It's sitting very still. Even if you can just look at a camera, that is all that is required to do the screening. You laminate the picture that goes with the action or the task and place it in the room clearly visible for easy reference. For instance, if you are going to do like a hearing screening, we put that picture on the door of that room, and then the student knows that this is what is going to happen when I enter this door. So the speech teacher will check my ears and hearing. When I hear a sound, I need to raise my hand. After I am all done, I will pick my prize. And you can have it at first, then board, so you'll have all of these steps. They know that they have completed those steps, and then they know what to expect and what they are working for. The layout of the room that day for the vision screening, we had a carpet in the left upper corner. If you look at this diagram, this picture, we had the treasure box on the way out. So you go in, and then when you go out, you're going to see it. And there were 3 desks set up facing the smartboard, because the students know that they face the smartboard when they are in class. There were only 3 seats right next to each other, and then the screeners, the staff was standing in front of them. We had the picture of the task on the door, and also taped to the desk, so that they know, laminated, that they know that this is what we are doing. So there's the first thing, our treasure box, full of treasures. And we had, I don't have the videos here right now, but it was very good to see it in action. We had a student that really is great with finding and doing what is expected in task, and working with a story-based intervention. He did not want to leave his classroom until we showed him the story-based intervention. Then he knew, oh, okay, I'm supposed to be doing this. Okay, that's easy, and he did the task. He walked to the classroom that the screening was done in, and he went into the classroom. We showed him the task picture. He remembered, okay, this is what we want to do. So sometimes you just have to remind the patient, this is what we're going to do in the moment. Just break it up into little steps. And if they've been prepared with a story-based intervention or a social story, you will have that available. Then just at the end of the screening, he has trouble with transition, and it looked like there was going to be a challenge. We showed him the picture again at his treasure box next, and immediately he perked up and did the task and moved on. So that is really a great tool to have for students. Have the story-based intervention and have the tasks pictures available. Have that with you. Then also we had a student in that room that was having was just going around and around in circles on the carpet, and they had tried everything, hopped him to the desk. It was very sweet. Hopping any kind of activity, seeing that the student is very active. It's great that they introduced the hopping. I thought that was great, and that didn't fit very far. Then we said, okay, we're going to help you. We are going to show you the picture, and we're going to help you to get to the desk. We're going to help you, take him by the hand, show him the picture as you're walking. He walked perfectly, very, very sweetly to the desk. He sat him down. He did the screening, and told him the next step. Next step is treasure box. So that I cannot stress how important the story-based interventions can be for such students. Okay. So we read the story to the students in class at least 5 times, and you can send it home as well. The parents can read through it. You laminate the story that you are using, and you familiarize the students with that hard copy. They can also pass it around, they can touch it and handle it, and we place the copy in view in the hallways. Send that about 2 weekends in advance. We send that copy home for parents to prepare their students, their children. We had a system where we knew exactly which student had to go where, and we could check off the student has already done this, and just discreetly with a little name and what still needs to be done. If you have a walkie-talkie system, that's also great, all call system. You can let them know the next class is ready, or the next 3 students. I'd prefer that to have the next 3 students rather than the whole class, but sometimes that combination can work out well. As long as you have the communication devices, reinforcers, and the younger students earlier. So we had a master list that we drew up for staff to reference. And sticky notes was left on the classroom doors too, to let everybody know what time they needed to be ready. And then we call them. The class lists, the scheduled time with the younger students first, color-coded if possible, and you allow 5 minutes, for instance, for the next class to get ready and arrive on the scheduled time. Everybody has to get ready and out the door. The vision screening room, we had clipboards and pens and pencils ready, and a timer in case you needed to let the student know, okay, I'll give you 1 minute, and then we're going to go on and for 2 minutes, and then we're going to do this. So if you are recording information by yourself in a post-it note, you can jot down the information, find the list later on, and add that information. You have the students have practice touching the wall with their heels, for instance, with height. For vision screening, you will tell the student, wear glasses or not, and sit at a desk. A nurse will have a camera that looks in your eyes. It does not hurt. It only takes a couple of seconds to look at the dots and have the story-based intervention ready. And that's what was all in the vision screening room. This is what I wanted to show you for students that were all waiting outside the door, but whichever you think will work for you, these students had their reinforcers, their communication devices, and it was pretty much first appointment for the day. On the smiley faces so early. Then this is the staff and the teacher right behind them to help if I'm not seeing any pictures of the notes on the presentation. Oh. Yeah, I don't really have notes. For some I had, but I can give those to you if you like later. Okay. Everybody still okay there? Okay. Alright. You can still hear me? Just a blank presentation slide. Okay. Can you see any pictures at all? Oh no. Okay, I'll ask Miss Jessica to post it. We have a picture. You see this picture that's on the screen right now? Yes, no notes. If you like, I can type it for you. You don't have pictures? Oh my goodness. We can ask Miss Jessica how we can fix that. Miss Jessica, are you there? Okay, I'll explain to you what I have. And then she can post it afterwards if you want to see it afterwards. I'm so sorry. Okay. So in this picture, we had just had them sitting facing a smart board, and the teacher behind them. Somebody recording behind them on a clipboard. I hope you can see it at some point. we were waiting for hearing screening, and each class had a time slot. The student was sitting there, you can see he has his communication device, and the other student is verbal. The student that needs noise cancelling headphones or radio. See this picture? This is just a picture that we had a little rainbow behind our Center of Excellence. Came into work one morning, and it was that morning, and it was a rainbow here. It was very sweet. Alright, so do you have any questions? We can post this presentation. Did you see any of the screening pictures? Where did you stop receiving the pictures? Okay, so when we do assessments, we need a few things for our students. If you can prepare them in advance, it would be great. If not, you might have to get creative and help the students as you go along, break it up into very small, manageable steps. And you have to always talk as you go along, explain, remain calm, and I hope that you have found some information